We looked further at those first 4 cuts, again, culling the medical literature to see what role obesity played in them, and that's shown by the gold subbars. So of the 33% that's cardiovascular, about 7 points is obesity. A little bit of cancer, perhaps 1%, although there's some evidence that may be understated. With diabetes, it's almost the whole enchilada. And with overweight obesity, it's tautologically the same. Add all that up, that would suggest that 27% of today's healthcare costs, and think about our healthcare bill. Total, it's about $2.5, $2.6 trillion. Now it is a T, it's not a B, it's a T. And the direct costs involved in that are about $1.8 or $1.9 trillion. And by direct, I mean what really goes to the providers as opposed to what goes to the medical researchers and the like. So a quarter of it is obesity. That says we ought to be focusing on it. The blue chart here is the fraction of our GDP that we spend on healthcare. And you'll note it was pretty low and pretty stable for the period 1965 to 75, started to bobble up in 85. In 2005, it's at 16. It's on its way to 30 plus by 2025 if current trends continue. The red line is the fraction of our population that is obese. Now, some people will say that obesity is genetic. I encourage you to look at the section of the chart that's circled in yellow. The evolution doesn't happen that quickly in humans. Fruit flies, maybe, but not humans. It's not genetic. It's due to the fact that versus 20 years ago, we eat bigger portions and we exercise less. It's all about changes in calories in and calories out. Therefore, hard though it may be, it's eminently reversible. We have the highest rate of obesity of any industrialized country in the world, 34%. The Japanese just increased to 3%, and their parliament has started to levy taxes on employers for any employee who is obese. And they're only at 9% of our level. Think about that, and think about the fact that a quarter of healthcare costs are in that baby blue bar. We have to do something about it, and we as a company are trying. We recently put in place, for this current year, as an overlay on our healthcare plan, a program called Healthy Measures, which is pretty simple. To earn the lowest possible premium, you have to voluntarily submit to be measured on weight, tobacco use, blood pressure, and cholesterol. And this is the only way you can get the lowest premium. The amount available to you if you volunteer in and pass all 4 is $780. Same for a covered spouse. So for a family, almost $1,600 a year, which is real money for most people. And 3/4 of our people opted in. Rebates are also available. If you clocked in last year as a smoker, you now are in the process of being retested as a smoker. If you are now a non-smoker, 2 things happen. You get the non-smoker rate for 2010, and on December 31st of this year, we'll write you a check for the full $312 incrementally you paid this year. So we reward good behavior from the outset and also improved behavior. And you might ask, well, why do we measure it? And when we measure smoking, people stand in line and have their cheeks swabbed. And we test for nicotine residue, and the test is good for about 8 weeks. And we reckon if somebody, that you can't fake it for 8 weeks. If you've been off it for 8 weeks, you've quit. Earlier, we had a smoking discount on the honor system, and we discovered that we had only half the smoking rate of the nation. Enough said. We've surveyed our people. Almost 80% say the program is good, very good, or excellent. The most common suggestion for improvement is more incentives, and we agree to that. The current limit under HIPAA is 20%. In both of the bills trying to be merged in the Senate, that number has been raised to 30. The effort to raise it to 30 was driven by us. That amendment is informally called the Safeway Amendment, and we're very proud of that. But with all the discussion of this, as you might imagine, there were many things that were said in Washington over the summer about this. Some were right, some were were less than right, and many of them were only partially right because whoever said them heard about our program from someone who heard about it from someone else who thinks he knew something about it, you know, the old telephone game. So about 8 weeks ago, I participated in a phone call with 4 people from the Department of Labor, 4 from the Department of Health and Human Services, and 2 from the White House healthcare staff, including Dr. Zeke Emanuel. And the reason the White House was on the call is that the President had been saying some very complimentary things about us, and frankly, I think Zeke wanted to make sure he wasn't going to get caught in a lie. The call was billed for 45 minutes. It went for an hour and a quarter. And on our side, it was me and 2 of our lawyers who were holding up flashcards telling me what to say and what not to say. I'm sorry to the lawyers in the room, but that's the way we work. I started off by explaining healthy measures in much more detail than I've had the time to do here this afternoon, and then I was grilled. I was grilled intensively, you know, things like, well, suppose you have this circumstance, and how about that situation? How do you deal with this? At the end of the hour and a quarter, and I might ask that some of the most intensive grilling came from Zeke Emanuel, which any of you who know Zeke will not be surprised by. At the end of it, a woman from the Department of Labor spoke up, and she said that she had been one of the primary authors of HIPAA in 1996, and she said that, Ken, if what you told me is what is true, and I assume that's the case, then Safeway is a good citizen, that you adhere not only to the letter, but to the spirit of HIPAA. You're doing exactly what we wanted to be done. And then she said the most fine thing, that if I were not happily employed by the federal government, I'd be delighted to be employed by a company like Safeway, which really made me feel good. I then said, you can repay me by making sure you do all your grocery shopping at Safeway in Washington, D.C. As a result of healthy measures, we're one of the very few, perhaps one of the only companies that has a profile of the obesity of its non-union population, all compiled by third parties, because under HIPAA, it's none of our business to know who is what BMI. If you add up the three numbers on the right there, you'll note that for this 3/4 of our population, that we have an obesity rate of 28%, which is well below the 34% of the nation. We're pleased about that. We ran a program over the summer called the 100-Day Challenge, in which we invited our people to form into teams of anywhere from 4 to 10 people, and they developed their own programs, but they agreed to keep track of the incremental activity that they undertook and changes in their caloric intake. And we ran it for 100 days. We posted results. We had nominal prizes. We're talking $25 gift cards, T-shirts, the infinitesimally small expense stuff. At the end of 100 days, what had happened was that the obesity rate, well, I'd say first thing, at the beginning, no, 38% obesity. So just the right people that we wanted in this, the people who were more obese on average than our overall population. By the end of the 100 days, that 38 was down to 31. And all of that shifted into the normal weight. So you can imagine people just shifting from right to left along this curve. We think we know how to do this. It was a pilot program. We're now rolling it out to our entire 200,000 employee population. We also are now running what we're calling the 60-day sprint, because we want to get people to get some good habits going before they overdo it at Thanksgiving and Christmas. And we will have multiple events of this type throughout 2010, because we think reinforcement is very important. It's awfully easy to slip back into old behaviors. In the course of setting this up and learning and doing some other stuff, we consulted with, among other people, the former head and founder of 24-Hour Fitness. And he taught us some very interesting things. He talked about how diets don't work and exercise regimens taken on January 2nd don't work. But what you really need to do is to identify the minor changes that you can make in your normal patterns that are sustainable for you, and undertake them. A pound is roughly 3,500 calories. So if over the course of a week you want to lose a pound, you have to take in 3,500 fewer calories than you did last week, or expend 3,500 more calories than you did last week, or some combination of those two.